So Jennifer will kind of walk us through some of these first introductory slides, and we'll kind of take turns going over some of this content, and then we will move into the demonstration of the Flux software with my colleague Thea, who is the grants intern I've had the pleasure of working with this year, who has been an amazing resource for this project. So Jennifer, I will hand it over to you to do this introduction piece, and thank you so much.
Sounds great. Welcome, everyone. So if I have not met you before, my name is Jennifer Piplick. I'm the Director of Marketing and Communications for the Verdant Health Commission. And as Zoe mentioned, I'll get us started with some of the kind of background information as we're learning more about our process and learning more about how to apply for funding here in the next quarter. So on the slide you see before you some introductions. We do have folks on the call today that include both staff and commissioners. So let me explain a little what that means. We are governed by a board of voter elected commissioners. So you see before you the 5 commissioners that are serving currently on our board of commissioners. So they are Dr. Jim Distelhorst, Bob Knowles, Dina Knutson, Fred Langer, and Kariana Wilson. And I believe we have, I think Dina is on the call. Thank you for joining us today. There may be another commissioner joining us as well. And then below that, you see a list of the staff. We have 8 full-time employees, and we also have 3 part-time employees right now. And so you'll hear today from several of us, and quite a few are on this call as well. So we can all be on the same page and learn together on this new process for applying for grants. All right, so first a little background on us, on the Verdant Health Commission. So here is our official mission statement and vision statement as well. Mission to improve the health and well-being of the whole community. I would say that we take that very seriously. We're very interested in serving the entire community that we're chartered to serve by our residents, and I'll talk a little bit more about that in a minute, what that means, who is our community and what area do we serve. But our vision statement, I think it's nice to highlight just the fact that our goal is to be a sustaining public resource. We're really looking for collaboration and creativity when it comes to meeting the needs of our diverse residents. We have a lot of different needs in this community and are excited to do what we can to support all of them. Further background, if you're unfamiliar with us, we are the program of Public Hospital District Number 2, Snohomish County. And as I mentioned, governed by a board of voter elected commissioners. Those individuals are elected to serve 6-year terms. They are the folks that make the decisions with regard to our funding opportunities, and so play an important role in this grant making process. All right, so taking us back a little, talking about our background as a funder in the community. So we launched, the Verdant Health Commission launched as the new program of the hospital district back in 2010, and we started grant making in 2011. And so you can see from 2011 through 2019, we were offering grants on kind of a rolling basis. Both one-time and multi-year program grants were considered ongoing by our board during their monthly board meetings. And then we also would issue special calls for proposals as needed. Those RFQs focused on needs that were identified, such as behavioral health. We had specific RFQ for behavioral health needs. We've also issued a couple times an RFQ for more infrastructure needs to support health and wellness in our community. So those kind of capital and infrastructure requests were issued very specifically. So that continued for about 8 years. We had some turnover in staffing and put a pause on our grant, on our typical process for grants at the end of 2019, right before COVID hit. And so 2020, we feel fortunate in that we were able to be flexible and nimble in considering kind of emergency needs of our community. And so in 2020, launched our COVID-19 emergency grants that continues to this day. And then in 2021, once fully staffed and ready to go again, we launched a new process for our grant making work that includes quarterly windows to apply. And so if you're on the call today, this information is sort of in preparation for our fourth quarter. And you see before you in the first 3 quarters of 2021, we were able to approve roughly close to $5 million of grant funding to support our community. So very excited about the work that we're doing thus far, and excited about what's to come with the next quarter and future years. As I mentioned, those COVID-19 emergency grants are also ongoing, and so Zoe will mention that later as well. Okay, so next I want to kind of talk a little bit about our community. When we talk about our community in South Snohomish County, what does that mean? That can mean different things to different people, different areas. And so what you see before you on this slide is sort of a very high level view of our geography. So this map represents the district boundaries. As a public hospital district, we were chartered to serve a very specific geography. And so you see here that that includes the cities of Briar, Edmonds, Linwood, Mount Lake Terrace, Woodway. It also includes a corner of the city of Bothell. And then the areas that are shaded a little bit lighter are unincorporated Snohomish County. So a pretty significant area of our district includes those that are in unincorporated areas. Generally speaking, to the south, our boundary is the King County line. To the north, it is 148th Street Southwest. The eastern boundary is a little bit trickier. There is not a perfectly straight line that aligns with this boundary. So in general terms, we do not go as far east as the city of Mill Creek, or as far north as the city of Mukilteo. Those are questions we often get. And so this gives kind of a high level piece. If you're interested, on our website, we do have this more detailed version. So this was updated just a few months ago to provide us with much greater detail down to the streets of our district. But just to orient you a little to this version, everything in the yellow color here is outside of our hospital district. So if it's yellow, it's outside of our boundary areas. We have, similarly as the last slide, there's some color coding for different city jurisdictions. And another piece that we added to this map that we thought would be helpful for many people is an overlay of the Edmonds School District boundary. So this purple dotted line that you see represents the Edmonds School District boundary areas. It is fairly close to ours. And so for some individuals, that can be really helpful kind of frame of reference. And so that piece is included here. Now, if you go to our website and view our grant application page, you'll see a map of the district. And it's kind of a basic map, the last one we looked at. When you click on it, the full size version of this map will be visible. So you can dig into that if you're interested in learning more. One more way to consider our service area is by zip code. A lot of individuals, especially those who are seeking grant dollars, keep track of outcomes and the audiences they're serving based off of zip codes. And so we have put this together also to provide that kind of context. So again, our district boundary is indicated by the blue line here, the water, and then the King County line at the bottom. And you see the zip codes listed to the right. It's important to note that some of these zip codes are fully contained within our hospital district boundaries. Some of them are not. So in particular, zip codes like 98012 and 98021, which are both Bothell zip codes. We include a piece of those zip codes, but not the entire zip code. And so there could be folks who live in that area that don't fit within our, or aren't part of our hospital district boundaries. 98087 is similar. So this is just a little additional information that hopefully is useful for you as you're thinking, when you hear us talk about our community, when you hear us talk about South Snohomish County to different folks, that does mean different things. So this is just a sense of our service area specifically. And I think I hand it off to Zoe at this point.
Thanks so much, Jennifer. So wanting to talk through kind of the purpose of these program grants. So these are these multi-year funding opportunities to support programs in South Snohomish County, defined as what Jennifer just previously laid out, just how we define that, and that support Verdant's mission of improving the health and well-being of that community, our whole community. And we seek programs that address priority areas that are identified by our commissioners annually. We think through this as kind of a comparison to the social determinants of health, or this concept of kind of all of the different levers that impact someone's health outcomes, including where they are born, live, work, play, and age. And when we look at the Verdant priority areas on the left of this table, kind of how they correlate to the social determinant of health areas on the right. So access to health care is a Verdant priority area, and that includes behavioral health, medical, and dental care. Housing, which is really how we help people stay housed in safe conditions. Childhood obesity, food security, supporting seniors, and other education and prevention. We'll go into a little bit more detail on what these mean, but you could see also there kind of how they compare to those social determinants of health. Housing is one of the newer priority areas for Verdant. And so we always want to share that this is really helping people gain and sustain housing. So it's not for capital development of housing facilities themselves. Similarly, other education and prevention is kind of a broader term for ideas that support resident health and wellness, that kind of address the social determinants of health and other emerging needs, but aren't clearly in one of those other categories. When we think through eligibility or funding parameters for these multi-year awards, there is no minimum or maximum request. Funds will be prioritized to support direct program expenses, so of an increasing focus to utilize our available funds as kind of responsibly and as broadly as possible. We may fund multiple programs in each priority area. Funds must be used to meet the health and wellness needs of the South Snohomish County residents. So again, in reference of those maps and zip codes for eligibility. Funds cannot be awarded for the benefit of an individual person, for political or religious uses, to retire debt, or strictly for fundraising purposes. This criteria you will see again in flux as part of the process for creating an account here shortly. And also, funds are not currently being awarded for programs or budgets that solely support capital and equipment requests. You'll see a link here to our kind of complete evaluation criteria for how grants are scored. We have 4 main areas of scoring, and these are the total points per that area. The first is opportunity or the community need for the proposed project or program. The proposed community impact and inclusion of diversity, equity, and inclusion, and really identifying how people who would be benefited or serviced by the program were involved in the creation, implementation, and evaluation of that work, as well as how staff of the requesting organization do or do not reflect the kind of ethnic, social, language makeups of the groups that are proposed to be served by the work. Also the desired outcome. So kind of what are you hoping to accomplish? And then the implementation. How likely are you to succeed in implementing the proposed scope of work? So we'll go back to our multi-year grants in a minute, also with the Flex implementation and how that will change, but also wanting to cover these COVID-19 emergency response grants. The 2022 application process will be announced soon, but they similarly are just for South Snohomish County residents. They support a Verdant priority area or community need that is a result of COVID. Typically, these are short-term programs or pilots, so not kind of lengthy or renewing contracts for work. And we accept concept papers on a rolling basis. So rather than having these specified times when applications are received, you can submit a concept paper at any time. Requests will be considered as submitted and staff will follow up to discuss any questions. You'll see the link here to the concept paper template on our website. COVID applications will also be in flux, and we will be launching that application process and additional training after this multi-year grant launch. So here we go. It's exciting to be here. So as some kind of background information, the goal of moving towards an electronic grant management software was really to try to streamline the process for grantees in terms of how they apply, track reports, payments, and information in a way that would not substantially change any of the content or kind of goals of the work. It also allows great opportunities for data and kind of analysis and visualizations, really see the impact of the work. You can drill down to some of those really nuanced factors that previously have been pretty separate in the submitted reports that you all provide. So it's a great way to kind of enhance, make our processes more efficient, but the goal was not to change how we engage with our partners and not to change the goals or as you'll see, if you've recently applied for funding, really even change the formatting or questions that we were asking for these multi-year awards. We do have a kind of a URL here for Flux. It will be embedded within our website as well. So it is verdanthealth.flux.io. And that will bring you to this landing page. You will see kind of this ability to log in if you have an established account, as well as on the right hand, some welcome text and the process or a button to create an account. And I think now we are going to be moving to a video about kind of how you will create your account and what that will look like on Flux. Jennifer, I don't know if we wanted to pause to do any questions around that eligibility before we launch into the really Flux specific components.
I think we could, what if we watch the video? I think that will help answer some questions about what needs to be inputted in order to create an account, and then maybe answer questions after that. Does that sound okay?
Perfect. All right. So again, another thank you to Thea for a lot of her help and partnership on this work. This is an overview of how one would create their account for the first time in Flux.
This is a video tutorial on signing up for your grantee portal account. So you're going to start at the Verdant Health Commission Grants Portal home screen. You'll see our logo in the top center. And you'll see on one side it says login now, and the other side has this welcome text. You're going to want to scroll down to the bottom of the welcome text and click this create an account now. You will click there and you will be met with some eligibility criteria. Please note that you must pass these eligibility requirements in order to be taken to the next step of inputting your organization information. So if the answers that you entered do not pass, so if you fail this eligibility requirement quiz, you will receive an error message and will not be able to move forward in Flux. The first question is that your program takes place within our service area. Your next question will be that you deliver services that improve the health and wellness of our community. The next one is that your services increase access.
It's just paused. You just have to hit play.
Access to our priority areas. This one is acknowledging that your funds would not be used for the benefit of individual person or for political or religious uses, etc. And your last one is that you have a business license or a fiscal agent and are eligible to receive a grant from a public agency. So once you acknowledge all of those, you will hit the submit button. So if I hit submit, I will come to this screen where I'm going to input the info about my organization. So you'll put your organization name here. Anything with this red asterisk is required. So that is what that little red asterisk signifies. You're going to want to include your address, city, state, so on and so forth. You then will want to include your organization phone number and your organization email. Then you'll want to include your tax ID here and your organization mission statement here. This one, your organization summary is not required, but it is important for you to fill out the organization summary and the mission statements, as these are automatically pulled into your funding request. So please note that and make sure that you also keep them up to date once you are in Flux as well. And the next step is going to be your primary contact info. So this is your contact information for yourself. And again, anything with the red asterisk here is required. So you're going to want to review this information before you submit it. If you do submit and you realize something is wrong, you will be able to edit this information later. So there's no stress there. You will hit the submit request button and you will receive this memo that tells you that your information has been submitted, and you'll receive an email from us within 2 business days. That is really important because if you are planning on filling out an application, you will want to sign up and give yourself a few days after signing up before you fill out the application. So do not expect to fill out your application immediately after setting up your account, as it does take a couple days for that confirmation email to be sent to you.
Thank you, Jennifer and Thea. That is excellent. Oh, go ahead, Jennifer.
I was just going to say, I think the plan is for me to stop sharing the slides so we can transition over. Does that sound right? Is there anything else before I do that?
Nope, that is exactly right. So what we're going to do now, and I think this is where we'll transition over into a live demonstration of what the process of applying for an application in Flux will look like. So you will need to go through what Thea just demonstrated in the video of creating your account. Again, the eligibility criteria there should look familiar. That was in the kind of the rules, so to speak, of who Verdant is able to provide funding to. Once you get through that and set up that account, that will be your organization profile. You can have multiple users connected to one organization, which we will go through at a different time. But at this point, it's really about creating that profile for yourself and your organization from which you would be applying under. So there are no further questions, and you can always pop a question into the chat box as well, so we can keep track of it there and circle back. We are going to be moving over to Thea demonstrating with that login that you just saw her create, how she would apply for a multi-year grant.
Yes, so we're going to share my screen and hope it works right. My computer's been a little slow today, so bear with me. All right, can you guys see that, the home screen? Okay, perfect. So at this point, obviously you're already going to have done this side. So you're just going to log in with the email and password that you set up for yourself. And hopefully this will work. All right, click sign in. Like I said, my internet's a little sluggish today. And you're going to be taken to your grantee portal home screen. There we go, which looks like this. And from there, it's super self-explanatory. You're going to hit apply for funding right underneath the information tab over there. So we're just going to focus on this multi-year health program funding. So over on the right, you're going to click this button that says apply for the multi-year program grant, and you're going to be taken to the application, which looks like this. So you'll have up at the top, you'll see your organization name, and then you're going to see this table of contents right here. A couple notes before I start going through the application. This table of contents doubles as a navigation tool. So I can navigate to the different sections of the application by just clicking on them. So like if I want to go to budget, it'll take me down there. That's important because you are on a computer, and computers sometimes don't like to be nice, and you might get taken back up to the top for whatever reason. So instead of having to scroll through the application, you can just click on these and you'll be taken to wherever you want to go. I also want to point out these little red asterisks right here. Like was mentioned in the video, those indicate a required field, so you won't be able to submit an application if one of those is left blank. Another note is these little more information. Those are PDFs that are linked, and they're scattered throughout the application, and they just provide you more information. So like right here, they're indicated by this blue font. And if I click on them, hopefully this will take me where I want to go. There we go. And you'll be taken to a PDF that will give you more information on whatever it is you clicked. So in this case, the primary contact and the primary signatory. And I'll try and point those out just a second as I go. The last one is I want to point out the save and continue and the save and close button down here. They might switch places. I figured out as I've been navigating through the portal that whichever one you used most recently in the portal is going to appear on the right. So watch which one you're clicking. However, if you do accidentally hit save and close instead of save and continue, it's not a big deal. I'll show you. So if I hit save and close, it's going to take me to the submit screen. But I can get back to the application by just hitting this edit button up in the top right hand corner. So as you, if it wants to take me back, there it goes. Your save and continue button is your save button. So save as you go. I'd recommend using this at the end of each section or anytime you input a large chunk of text, just to make sure that your progress gets saved so you don't lose anything halfway through the application. All right, and I think that was all my little notes. So we're going to start going through. So you're going to start with your organization information. Some of this will automatically be pulled from your organization's tab. So like the organization and location. These two can be changed, but I don't see you having to change those, but they are, you can. The mission statement and the organization summary down here, those cannot be edited on your application. You can edit those in your organization tab, but not on the application. So it's important that you keep those up to date. The next step is going to be inputting a primary contact and a primary signatory. Like I pointed out, there's more information on what those are in this PDF here. There's two different ways to add a contact and a signatory. The first one is to use the drop down and just select from the people list you already have. The other option is to click this add new button, and you'll be able to add a new person as either your contact or your signatory. Note that the first name, the last name, and the email are all that's required, but like with anything, you're more than welcome to add more information if you see fit. So we're gonna add another person here. And then I'll hit save. And your person will pop up with their email right where you want them to. The next one is if this grant includes a fiscal sponsor, and there's a definition underneath it right here that tells you what a fiscal sponsorship is. If I hit no, there will be no further steps. If I hit yes, a pop-up will appear that will ask you to include your fiscal organization information. That includes name, address, contact name and email, signatory name and email, and organization mission. And you can input all of that in this text box here. All right, and then the next section is program details. And I'm actually going to hit save and continue at the end of this section. So the program details is the overview of your program. So you're going to have the program title and a program summary. Your program summary is basically the elevator pitch, who you are, what you're trying to do, what your project is. Then you're going to choose a start date and end date. And you're going to use this little calendar icon right here. And you're going to select from the drop downs what you want your start date and end date to be. It'll pop up right there. Same thing with the end date. And the number of contingent years you are requested, you will select 1, 2, or 3 there. Now you're going to input your total program budget for your first year and your amount requested from Verdant. Again, there's a little PDF right here that'll give you some information on that. Your total program budget is the total amount budgeted for the entire program, and your amount requested from Verdant is just the amount that you are requesting from us. These two numbers will be used to generate the percentage funded by Verdant, but I'll show you that later in the budget section because that doesn't happen until a little bit later in the application. You're going to state whether this is a new or renewal. If you are unsure, there is little helpful definitions right there. And then you're going to select which priority area your program falls under. You can select more than one, but you don't have to. So you'll select them by clicking the priority area you want and using this arrow to move it there. If you accidentally move one over that you didn't mean to move, you can just click on it. Oh, there we go. You can just click on it and move it back. There are 9 narrative questions. At this point in the application, you're going to hit these narrative portions. They will be linked on the website so you can review them beforehand, and I'm going to hand it over to Zoe to go over that portion with you.
Yeah. So these narrative questions are the same questions that we have been using throughout the year in the Word document download. And the goal of these is really to provide additional information in those kind of 4 basic scoring categories that we talked about in the beginning of the presentation. So you'll see each piece is required. So we do require a response to each narrative prompt. And it's really important to kind of go back and reference the whole prompt because there are a couple that have kind of multiple questions embedded within one. So you'll see the first being, what is the community need for this project program? Be as specific as possible using local statistics and agency information to show the need. So Thea here could enter free text, enter in information. There's also the ability to copy and paste in information, including kind of rich text, which is a unique function of Flux. And as Thea mentioned, we will have a Word document of these narrative questions available on our website so that people can work that way and then copy them into the Flux system, as well as working on kind of an application outside of the period of time that you will be able to submit that in Flux. As Thea mentioned, with the save and continue versus save and close functionality, you also can save this as a draft and come back and work on it later, or have multiple people working on it, or send it to me to look at. So there's a lot of good functionality built in. Additionally, here we have, how does the program directly impact Verdant's priority areas, one or multiple? And you will see you can reference back up to that PDF link with more information about our priority areas at the top where you selected them. We then ask here, and again, this is a multi-part question, who will be served by the program, and explain how the program serves residents of South Snohomish County and what your current strategies are or will be to recruit participants. Here's another prompt for more information about Verdant service areas. If you wanted to click there, it's going to reference a lot of the information about geographic and other requirements. Here's where we'll come down to a question regarding equity, diversity, and inclusion and community involvement. This is another multi-part question. So it asks, how does this program demonstrate equity, diversity, and inclusion? How will the populations you intend to serve be involved in program development, delivery, and evaluation? And how are the program or organization staff reflective of the populations you intend to serve? Well, next asks, who are other organizations that offer similar services to this program? How will you collaborate with them, and how is your program distinct? Importantly, we know that oftentimes there are many different similar seeming organizations providing work, and usually the piece that is most interesting or clarifying is what is distinct about them, but also knowing how they work together to make sure that kind of all residents are eligible for a service, or how they would refer between themselves. You'll see here in a prompt that we're asking, in addition to completing an outcome section below, where you will be indicating the specific kind of metrics you will be accomplishing through this work, just broadly, kind of in a narrative sense, what is the anticipated impact of the program? And what is your strategy for successful achievement and measurement of the outcomes that you include in the table following this section? This is another important piece here. So who are the key partners that will support this program and their roles? This is typically meant to mean external partners, so other organizations, programs, referral sources. And you'll see here there's a drop-down menu that asks, do any of the included partners provide facilities and or roles that are critical to meeting your outcomes? On this drop-down here, you'll select yes or no. If you select yes, so you'll see in italics below, it says, if so, please include a letter of support from each partner meeting the criteria in the document sections below. And when we get to that document upload piece, you'll see that there actually is a request where you can upload that letter of support. If you answered no here, there would not be the letter of support document upload request. We then ask how the program will be staffed and what the organizational capacity is to support the program. What previous success has your organization had with delivering the services in the program? If this is a new program to your organization, this could be a great opportunity to explain why you think you will be able to successfully implement and operationalize the scope of work. And then lastly, similar to the narrative question regarding outcomes, in addition to completing the formal budget form below, narratively just describe how you intend to use the funds and what other funding sources or resources have already been allocated to this program. So for instance, if you've received additional grants or from other funders, what are they? If you generate kind of participant fees or patient generated revenue, including that kind of briefly here. That is the narrative piece. And again, you can do that in a Word document and then kind of copy and paste that into these fields. There's a variety of ways to do that. You can draft it directly into these text boxes and save and continue as you go. And a lot of that is really just personal preference, but there is a way to save as a draft as you go directly within Flex. I'm going to pass it back over to Thea to go over the budget form. Unmute yourself.
There we go. It keeps muting me. I hit it 3 times. All right. So now we're going to move on to the budget section. So you're going to see this little percent showed up, but it hasn't filled in yet. It's not going to fill in until you input your budget because it wants to make sure that the number that you entered at the top matches the number in this budgeted piece. So to add a budget, you're going to hit this little plus icon. you're going to input the name of your project here, and then the year. So year 1, 2, or 3, it'll be the same as what you put up above. And then the same start date that you entered. If it wants to, there we go. And then you're gonna have this table here where you're gonna budget out your Verdant request. So this table is only focusing on the Verdant request. You're not gonna do anything with your program total budget. And you're gonna ignore this side here because you don't have any actual data for that yet. That's going to be filled out later because it is the same format as your reporting. So you're only going to be focused on this little budgeted column here, and you're going to budget out your program in each of these categories. So you have personal expenses, direct project expenses, administrative expenses, subcontractual expenses, oh my goodness, and other. And then when you come down here, this portion is optional, but you can include it if you think that it will help us to have more information or more detailed breakdown. So this is where you have the option of including line item breakdowns for each of those categories. And you can just use this text box here and fill it in however you want. So whether that's a bulleted list or just listing everything out, that is what these text boxes are for. But again, you don't have to do that. We would just recommend it if you think it would add more clarification for us. And once that's all filled in, you're going to hit this save button. And that budget is going to be inputted into your application. Give it a second. To the back of the top. So we're going to go back down there. And there's your budget table. You're going to notice this percent still hasn't showed up yet. You do need to hit save and continue to refresh it in order for that percent to show up. It's just an extra step that is needed. And there you can see that percent is now there. And then the next portion is your outcome section. There's only one required outcome, which is your number of individuals served, but we recommend you include at least 2 more. And the same thing with the budget, you're going to use this plus icon. And the first, you're going to select the year. The first metric is going to be individuals served. And then you're going to input your goal for that metric. So your metric is whatever your outcome is. And then obviously your annual goal is the goal for that outcome. You're going to hit save. Like I said, this is where this navigation at the top comes in really handy because sometimes it likes to jump around. And you're going to see that your outcome is now visible there. Once you input the individual served, check this box here saying that you have added the number of individuals served. And then you can add other metrics using the plus icon in the same way as you see fit. And they will all appear. So here, I'll add another one to show you what it'll look like. And they're just going to keep listing underneath each other right there. All right, and then the next section is going to be your acknowledgement section, and Zoe is going to go over that with you.
Yeah. And just like with the budget, the outcomes, these tables that are created, this will also be how you report. And it is very straightforward and simple, where you actually will just go back into a field that looks very similar to this and type in your actuals, and that will generate documents that you will be able to reference. It's very cool. So the acknowledgements here, this is a series of drop downs. Again, this is kind of more of that eligibility kind of contractual pieces here. So these are all yes or no and or a multiple choice. The first being, I acknowledge that I can track and report outcomes and required reporting elements. We will have information on the grantee portal where we started this application regarding what those reports look like. But the basic piece here is that any budget expense that you added into your budget and or metric and goal that you entered into your outcomes, confirming that you have a way that you will be able to track and report on your progress towards each of those. You then have here, I acknowledge I can provide evidence of liability insurance meeting minimum criteria. We are working to determine minimum criteria. So at this point, it is just kind of the having liability insurance, general operating liability insurance. And if you have questions about that or concerns, also always please reach out to us and we can work together on that. This is a choose one, which is I can restrict funds received to approved budget, or I'm willing to learn how to restrict funds received to approved budget. And so that would be the first is, you know, how you can kind of track specifically those budget expenses to this specific contract. The second being you'd like some help in doing so. Myself and my colleague Tammy, our Director of Finance and Operations, are happy to work with you on that. And then our last question here is, to the best of my knowledge and belief, all the information in this application is true and correct, and I am authorized by my organization to submit this application. So once you go through those yes or no answers, you will go into the final piece here, which is around document uploads. And I'm going to hand this back to Thea.
So where we have the document upload portion, as you can see, there's 3 here because we selected yes on that one drop down in the middle of the narrative questions. If you selected no, this third letters of support one will not show up. You'll only see the board of directors and the financial statements or audits. So to input a document, you're just going to hit this plus icon and it's going to give you this pop-up and you're going to hit add files. There we go. And this is where it gets a little funny, is you have to drag it into the box. So it's not like you're going to double click on it because that'll just open your document. You're going to select it and drag it over to the box. And then you'll hit start upload. Outside of that, start upload. And you'll get this little upload complete in the bottom. And then you can just hit this X and your document will appear right down here. Same thing with the financial statements or audits, but I'm not going to add that quite yet because I want to show you what happens later if you forget something when you submit. Letters of support, you can add more than one document. You might need more than 1 letters of support. So I can do the same thing, hit add files, and I can drag however many documents I want over there. And then same thing, start upload. And it'll say upload complete. And your documents will appear right there. So when you're all done with your application, you'll hit save and close. And it'll take you to your submitting screen where you can review everything that you inputted. And if everything looks complete, you can hit the submit button. Please note that save and close doesn't necessarily mean you have to submit. If you hit save and close and you just keep navigating the portal as normal, it's just going to send your request over to this little pending request tab right here, and you can go back in and edit it later. So you don't have to do your application all at once if you don't want to. So I'm going to hit submit and then say okay, that I know I'm submitting the form. And since I forgot that one little document upload, it should pop up with a little error message up there. And you're going to either hit, it's kind of finicky. So you either hit jump to previous error or jump to next error. One of them will take you to the error that is there. And it took me down to this document section and it's highlighting that I haven't uploaded a financial statement or audit. So I can add that in. And then I can hit save and close again, and I should be able to submit my application without any problems this time. Hello, internet. There it goes. So I can hit submit. Same thing. It should. Why did that not go? Oh, there it is. There's a little notification. I'll do it one more time so you can see it. Let's see if it'll pop up again. There's a little notification that says that your grant's been submitted. But again, my internet's being slow today, so it's taking a minute. You'll also see the little one popped up by the submitted requests, which means that your submit was moved there. So yeah, and that is the application process. I'm gonna get out of my screen share.
Thank you, Thea.
Yeah.
And so important to note there with the once you've submitted, you cannot proactively edit. But if you submit that and I see like, oh, this, I'm not sure what this means, or it seems like they didn't do X, Y, Z, if it's before the deadline, I can send it back. And so you'll see there you have three choices. One was pending, one was request to edit, and one was submitted. So there is the opportunity where I would send something back with a request to edit. And if it's before the final due date for that quarterly process, you would be able to resubmit then with those requested edits. And it keeps kind of a audit trail, for lack of a better word, of kind of this was the request, this was the change, so that everybody can track kind of what the progress is. I also wanted to highlight on the financial statements. So whether audit or financial statements, there is some more information there around kind of which types of organizations per Washington state law are required to submit an audit. And if you don't meet that threshold, what kind of the acceptable alternatives are, with some samples there. And again, you can always reach out if you have questions about, does this work? Is this kind of meet the criteria? And then the last piece on the submit, I think it's a little bit confusing, and this is a hard baked into Flux, that it says your request has been updated. And you'll get an email that says that your request has been submitted, but sometimes you're like, was that it? Did I do it? And you will see it, like Thea showed, move to a submitted tab there, which reflects that it was submitted, but you will also receive a kind of automatic email that will say it was submitted and here's kind of the process. Okay, so again, this will be in later dates. We're just talking about applying now, but we will be also providing kind of an overview, training materials on what reporting and the payout pieces will look like. This recording, in addition to lots of other recordings and written training materials, will be available on our website, as well as embedded within Flux. There is a resources tab under the grantee portal, which will house many of these. And I believe, Jennifer, that many of them are already up on our website. So if you want to look at just a specific thing, like what did they say again about this form or the budget, we'll have them kind of as bite size, as well as an overarching kind of comprehensive document. And also Thea and I are always available to ask questions. And I'm not sure, Jennifer, if we have the slide up, but we'll also be doing weekly, what we're calling like office hours for Flux. It will just be open Zoom times that anyone can join and say, hey, I can't figure this out, or I'm stuck on this. And Thea and I will be able to provide kind of coaching at that point, as well as at any time one-on-one. We do have a contract with kind of the Flux if there's actually a system issue, like, oh, that button stopped working, that we are able to escalate concerns to. Thea and I will be able to kind of do a lot of the clarification of if everything is functional, and we just have a question on how to utilize it.
So let's go back to, we have some kind of frequently asked questions that section that sort of evolved over the years. And so let's go through some of those and a few more kind of highlights, and then open it up to any questions people have. So do feel free to pop something in the chat if you have a question in mind, but let's revert back to the slides. And I can walk us through these FAQs and some of these timeline pieces, and then we'll open it up to broader questions. Okay, so some of these are not specific to this new kind of portal process, but just in general, our work in how, what types of questions we see over the years. So the first question is, do programs need to serve a specific population? And, you know, we've gone over our district boundaries, and that's really the only requirement, is that these grants must serve the residents of our district. Within that, there could be kind of subpopulations within the community that you're trying to target, and that's absolutely fine. But really, the only parameter is they need to be serving district residents. Who is eligible to submit an application? It's actually quite broad. You can be a nonprofit, a for-profit, or another government organization, as long as your program matches our guidelines and eligibility criteria. A question about if you're currently funded by Verdant, if you've got a grant that's active right now and is going to expire, what process do I use, and is this the renewal process? And yes, it is. We recommend that anybody who's currently funded by Verdant and set to expire by the end of 2021 use this next opportunity, this Q4 opportunity, to apply for funding. The question, can I submit multiple applications? The answer is yes. Your organization is not limited to only one application at a time. Here's the piece Zoe mentioned earlier. So our grant portal, we're hosting, Thea and Zoe are hosting sort of office hours, so that if you've created an account and are in there working on it and trying to need some help troubleshooting something or have questions, you would be welcome to hop on to one of these open kind of Zoom drop-in office hours. Rather than include all the different Zoom links on this slide, they are all posted on our grant application web page on our site, and will be on the calendar on our website as well. And so, but just keep in mind that those options exist, and will be happening weekly through the application, through the period in which we're accepting applications, which is November 8th through the 19th. I'm not sure that that's been on the slide yet, but coming up next month. Let's see. Question around DEI work. What has changed with our application process to reflect DEI? And Zoe went through this in the narrative portion of the application. We are requesting a description of how your program demonstrates equity, diversity, and inclusion, and it is part of what's being scored for your application. So please take into consideration all of those questions that are contained within that narrative. Zoe mentions that some of those prompts have multiple questions, so please address them all. We're looking for how you're engaging the community in the creation of your program, and also within the staff to support the work. We, as an organization, are working on improving our efforts to support diversity, equity, and inclusion within our community, and know that different organizations are at different stages of some of this work. And so recognizing that, we appreciate the work that you're doing, and just ask that you be clear in sort of your responses to those prompts. So that is new this year. If you've been an applicant to our grants, if you've applied in the past for grants prior to 2021, there were not questions about DEI work at the time. So that is something that's been added this year. All right, a timeline, just sort of check in on where we're at with this current quarter. So this is for the Q4 of 2021. We announced this funding opportunity last month, and today is October 11th, and you're participating in our Q&A session. So the window for submitting applications is November 8th through the 19th of 2021. And following that, we will it will go through sort of an internal process. Our program committee of the board, which includes 2 of our Board of Commissioner members, will review it during their monthly committee meeting that's taking place, that's scheduled sometime the week of December 6th. Our regular board meeting in the month of December is on the 15th, and that is the meeting at which our Board of Commissioners will make determinations about what is being funded. And so either December 15th or 16th, if you're an applicant in this period, you'll receive communication from us about the decision that was made at that board meeting with the intent to start contracts January 1st, 2022. If you're participating in this call today because you're just trying to plan ahead of time, please know that we'll have another application window in 2022, early January or February. We're still working on some of the exact timing for that. But this is a quarterly process, and this is the timeline just for this fourth quarter. And we'll be looking forward to offering this again in 22. Did include on the slide contact information for Zoe and our Director of Finance and Operations, Tammy, who can assist with questions related to budget and auditing and those other pieces Zoe mentioned. So with that, I'm going to stop the screen share and see if we have other questions. Feel free to put questions in the chat or unmute yourself and share them with us here.
I have a quick question, even though I'm not a fund-up partner. I noticed that the calendars lets you, if I saw it correctly, it's not picky about the month that it starts and the month that it ends. You can put them backwards. Does that make sense?
Yeah.
Would it let you submit if you put from
Yeah.
December to October of the same year? Would it kick it back?
That was a great, I actually was texting Thea about that when I was like, interesting, right? So I think also we're learning as part of this of what is a hardwired error message, right? And that would be something, if it was submitted, that I would be sending back to say, that would be a request to edit. Can you clarify kind of the end state here? So yeah, I think we're all learning together too, in terms of like what is going to be, we have some choice over what's a hard stop versus what is not, but there will always be the ability to edit and clarify.
Thank you. Especially at the end of the year, in the old days when we were doing checks, you kept on writing the previous year until you got used to it. And I just wanted to make sure there was a way, less work for you, Zoe.
No, it's a good, it was a good question. Good catch. I was like, what's going to happen? There are other questions. I think this is also like for the processors out there. If you just start thinking through and then you come up with the like, wait, how would that always email or call or we're always happy to jump on a call and talk it through. The goal is to make this as painless as possible. And we really welcome feedback about opportunities to enhance the process as well. So we do these quarterly surveys of applicants as well to really, because it's important to us that this is as low barrier as possible.
So I have a question, Zoe.
Yeah.
This is
Yeah.
Dina.
Hi.
So what is our intention in terms of like people who have language
Mhm.
or other pieces that they need help with? Say English isn't their first language and they want to put in an application for an organization. How would they go about doing that?
It's a great question. And one of the things that is so exciting about Flex is it is translatable. And so they have a kind of current menu of languages that it is translatable into that is expanding. And Thea and I were at, I think they call it Flexicon, their annual conference where they were really talking through that too, around like how can we increase kind of those menus of options. But we will make sure that is obvious too on the kind of on that application page with our partners there at Flex of how people would do that.
Because I would say the one other question I had was, say somebody looks at our priority areas and they're like, oh, I don't know if what I'm thinking of actually fits those priority areas. And since that has to be the piece in order to get into the actual applications, you have to put on the front piece where you're, what should they do?
For specifically for folks for whom kind of reading the definitions in English would be a barrier.
Anybody. I mean,
Oh.
say I was doing swim lessons. Okay. I wanted to get funding for swim lessons. And I'm not sure about how that fits into a priority. Now, I know that maybe I might think other education and, you know, but is there, say somebody has something, they're just not sure about what priority area it would fit, because it automatically at the front end would knock you out if you don't hit one of those priority areas. I'm wondering what they should do if they have those questions.
Absolutely. And it's tricky with that. So we will always have all of these materials on our website. So here's what we mean about our priority areas. So we'll have a way that people can access all of those resources outside of Flux itself. But I also think that's great feedback around how do we also get really upstream and proactive around gauging from folks if that is a barrier, if they are struggling to decipher if they're eligible. I think with the planned website kind of redevelopment, we're also really trying to streamline the grants page to be kind of provide much more clarity and context around the goals and eligibility. But I think it's something we're going to have to be really mindful about.
And I hate to be the one to ask another question, but
No, it's fine.
I guess my other question is when we're putting this together, what if somebody doesn't have, say their computer system isn't up to date enough to meet this tech level, and they're having difficulties on the tech end of applying, what would we as an organization, how would we help them?
Yes, we have a couple what we call kind of floater or loaner computers. So people would be welcome to come complete the application on the computers at Verdant. And or I know we've been partnering with like the Community Foundation and others who also provide that support, either by the technology and or partnership to submit. We used to have a question in the FAQs around if I don't have the specific software like Word and Excel, et cetera, what do I do? And I think that's a good call out of adding that back into the FAQs around if the technology is a barrier, what do I do? Because we certainly don't want that to be a barrier to applying.
Well, thank you. That was very
Thank
helpful.
you. Good questions.
And those are great questions, Zena. And I would just say that as we're experiencing this and feeling our way through, there are a lot of things that we'll be updating and adding as resources. So right now on our website, you can access the grant portal, you can create your accounts. There are PDF guides similar to what Thea demonstrated in the system itself that can give you background information on how to apply and the outcomes piece and the budget piece. So even before somebody gets to the point where they're in Flux, there are resources on our website. We'll continue to add to that. Our website, just to mention that, Zoe nodded to this, that we're doing a website redesign right now, and our new website will launch in December. We'll have translate kind of abilities as well to support people with different language needs. And so all of this we're doing everything we can, and always room for improvement. So very grateful and thankful for feedback people have or questions you have that you're struggling with, that maybe we can help create something. If you're the one with the question, it's likely that somebody else has had that question too. And so we do need to hear that feedback. And so appreciate this being our first time doing this. You're all in it with us, and hopefully we can iron out any wrinkles that come up as we're going through it.
That's great, Jennifer. And I think similar to the websites, which will have like a very desktop and mobile functionality in terms of ease of access. Flux also is very user-friendly in a mobile perspective. So if people have a smartphone, I can't really imagine doing a whole application, but you could on your smartphone or tablet. So I think trying to figure out all of those different pieces about how people would engage or interact with all of our kind of interfaces. Sandra, you have your hand up.
Dina and I, Commissioner Knudsen and I are the ones taking the time. I was wondering if you would say, for those who might be a little anxious, including myself, looking at this new, it seems very user friendly. So thank you for all the great work that went into designing it. Would you suggest that a party interested in applying create a Word document like we used to do, when they're comfortable with the information, then start importing it, so to speak, or is that, or do you think that there isn't really an advantage, since you can kick it back and say, well, you want to look at this again? Would you recommend that people have like a draft on a hard copy that they can then input?
Totally user preference. So I think that is, you certainly can do that. And that's our intention of having the narrative questions available as a document download for folks who are more comfortable doing that. But you can kind of edit draft before submitting within the software. And then also, again, the kickback to edit. So I think it's totally a matter of preference.
I guess along those similar lines, Sandra, that question prompted me to think, and maybe to encourage people not to wait till the end of the application period to submit, to number one, create your account, and number two, submit, because with an opportunity, if you submit sooner in the window, then there'll be an opportunity then to take a look and make sure nothing's missing or something's off. So that might be important this time more than in the past with attachments, Word documents, and Excel we've been using in the past. If I could also let people know, if you're interested, I don't think we mentioned this sooner, if you're interested in getting an email with the recording from today and links to document to support all of this, please feel free to put your email in the chat so we can follow up with you. It'll take just a little time, I think, to get all of this added to our website, and we're happy to send that to you once it's live on our site with links. So feel free, if you're interested in that, pop in your name and email in the chat.
And Jennifer, we should have this up on the website kind of by the end of the week also, the recording, the slides, the FAQs, all those pieces, and an increasing library too of resources for Flex that will be both video and written. So PDFs, like you saw, kind of embedded within the software. We'll also have those same available on our website, so not within the system, as well as some that are more robust and kind of an entire application guide if people want to see the whole thing together, or if they want to access just this one piece. And we welcome feedback as well on those pieces. The intention is that they are helpful. So we will kind of keep adding those. The basics are there and available on the website, and the written pieces, as well as kind of an increasing number of video pieces. We will be creating a YouTube playlist. And again, you'll be able to look at all of them together and or reference a specific chapter that is one piece or component of the application.
So I had one other suggestion. As we were going through, while you're going through the application, it came to me that you had certain areas like the budget and some of these other pieces that for organizations, or even what a fiscal agent is, where I was wondering, because we had talked about having some trainings for some of the people. Maybe some of the things that we could do is have some easy trainings for people on some of these subjects, maybe even creating some videos, kind of like what Thea did, for people to kind of look at and then be able to ask questions around. Just a thought.
No, that's great. And that's absolutely the intention of the documents. So each of those areas will have a document and a video of like, this is what this is, or the goal is. And I think we also can be really proactive in the office hours of trying to solicit, like, where are there questions that aren't being answered around kind of what's the goal here, or what does that mean, and create or edit, make additional training materials based on that feedback. It's good. Thank you.
Any other questions? This has been great, I think, both for us as a staff to start the process with rolling this out, and also hopefully helpful to all of you. Feel free to reach out anytime if you have questions. Know that we'll get more of those resources available, and we're really excited about this. If there are no other questions, then I think we will sign off. We really appreciate you joining us today.
Thanks so much, everybody.
Thank you.
Thank you.
Thank you
Take
for the
care.
great job you guys are doing.